Thank you. Madam Secretary, may we call the Policy Subcommittee to order, please?
Which one do I have here? Is this policy? No, I got the wrong one. Oh, man, I forgot it. Oh, no, it's right here. Chairperson Doherty? Here. Ms. Del Rossi?
Here.
Two present.
I would also like to add that my colleague, School Committee Member Ms. Martin and Mr. Lay are also present. We may have people Zooming in. I know there is a Zoom link if the mayor or other school committee members can make it. So if we look at the agenda, I'd like to move the policy on communications down after the kindergarten registration timeline. We do have a member of the nursing staff here to talk to us, and I'd like to give Ms. Moffett an opportunity to share her thoughts before and right from the beginning of the meeting. I know we have a limited time. So I would entertain a motion by Ms. Del Rossi to go out of order. Thank you. Seconded by myself. All those in favor? Aye.
Aye.
So we're moving the communications on the agenda under the kindergarten agenda item, and so that puts the pre-K registration timeline as the first item on the agenda. I don't know if anybody from the administration wants to talk first? No? So in terms of the pre-K registration timeline, what were we thinking about, what were we doing for a timeline last year for pre-K, and how does that relate to what we've done in previous years?
Thank you, Ms. Doherty. So the timeline for pre-K and kindergarten has been impacted by the shift of the online registration, impacted by COVID. We're kind of past that now. And so I did speak with my team around what would feasibly work for this year. We did talk about prior years versus this year. And what we came up with was that, so our goal is to register all current 4-year-olds in LPS pre-K, community-based pre-K, and daycare in the city of Lowell. So anyone who right now is in any kind of organization or program, they are a captive audience, and we should be able to communicate with them around get your registration materials in starting next week. We anticipate that the application is open right now since the pre-K and K event that happened this week. But now it's a matter of pushing the information out. So that communication push will start next week. And again, anyone who is in a program right now, we feel like with strong communication to any of our community partners, our pre-K classrooms, our hope is that every family will be able to get the materials, the registration materials in to get processed. I'm told that the application typically has closed in April, and that is our goal, to close it on April 24th. Typically, it takes a week to finalize all of the applications that have come in. And looking at the trend of applications from the prior years, we do feel confident that if we hold the first lottery the first week of May, the same people who apply early are going to have applied by that point. So the first lottery for both pre-K and kindergarten would be the first week of May. And then after that, it's first come, first served for pre-K. However, for kindergarten, we did have 2 subsequent lotteries that we had started, I believe, last year.
Maybe we should. Sorry to interrupt, but I think we should just stay on the pre-K first.
Oh, sure.
And then we'll do the K, because we also had some changes in the language, and we want to get that settled tonight for you as well.
Sure.
So I don't know if anybody had any questions about what Ms. Phillips told us about pre-K? You said you have events this week, or they happened last week?
The events happened this week.
And Oh, so well, today's,
Oh,
It
I'm
is Monday.
sorry. Wow, it's Monday. It happened last week.
they did happen last week. And at that time, what did you tell parents in terms of when they needed to register? What was the deadline for pre-K registration that was communicated last week?
They weren't given a deadline. They were told to come explore the different schools, understand the registration process, and that the application would be open.
Ms. Del Rossi?
I have a question in terms of, I know special ed students are different, but in terms of regular ed preschool students that are allowed to come into our preschool programs, do they have guidelines such as having to be potty trained by the time they enter preschool to be able to be in the lottery, to be able to be in our preschools?
Our preschool application is based on age. So once you qualify for the preschool, we don't base the lottery on criteria such as that.
Okay, so I'm just thinking in terms of even like with staffing in that case, then so a teacher may have students who aren't potty trained in a regular ed class, and they may then have to be assuring that they're running and potty training their students, and now that's become an extracurricular on top of the mainstream like preschool needs of the curriculum. So I just am a little concerned about that. I've heard that there was some concerns throughout the district in terms of that. So I didn't know if there was a way that you could possibly get that to be maybe a box checked, or, you know, just to give somebody a heads up that, you know, you may be dealing with this. Like, this is going to be on top of what else is going on. You know, I know our special ed classrooms are one thing, and that, you know, that can't be helped. But in the regular ed setting, I think that should be addressed more clearly and precisely for a regular ed teacher have to handle that on top of a regular preschool curriculum.
And so I can definitely look into what our communications are around that with our preschool coordinator.
I also had a question regarding the lottery. So my understanding is we're going to universal pre-K, right? Every student who meets the age requirement will be eligible to attend pre-K, where before we had a very limited number. So what is the lottery and how does that come into play?
So the lottery is first for anyone wanting a seat in our programs. And part of what we wanted to change on the application, we entered into partnership with any community agency that indicated they could follow this, you know, similar criteria as we do to provide pre-K for students. So we were hoping that for those organizations that are in partnership with us, we could allow families to choose those programs as part of the application process. In the event they don't choose those programs and they only choose our LPS programs, if they don't get a full-time seat, we would then offer them the opportunity to attend at a partner organization. So if they say, I just want an LPS program, that's fine. If they don't get it in the lottery, our next step is to let them know you didn't get it in the lottery. Your next option is a part-time LPS program, or you can consider a community partner program.
So just to follow up on that, you expect to have all the applications in by April 24, and then the first week of May, you'll be able to give out assignments.
That's correct, for the first lottery. And currently in the policy, I believe, for the kindergarten policy, we stated a minimum of 50% of the seats would be placed. This past year, I think we placed closer to 60%. So if we found that we were only going to have 2 students in a lottery, we said it's not worth it to do all of that paperwork for 2 seats. We can fill, up to 60%. I think the only school that we could not accommodate was Pine Arts. There were many more students applying for that school than seats available, so they had to have a lottery. But the goal of the lottery is not to create, a barrier or a hardship for families. It's to be able to provide additional access for students whose families may not know the initial deadline. So those early applicants, we saw of everyone who came early last year, it was only one school where we had to run a lottery. Everyone else got placed in their first choice assignment. So we anticipate the same this year. Everyone who knows is going to sign up for kindergarten, and at that point we'll see which schools need a lottery. But historically, I'm told there have only been 3 to 4 schools that have required a lottery in prior years.
I think it's not a secret. I have great concerns about pushing this beyond the school year. So I'm just looking to figure out a way to get it done earlier while we have the staff. I think the impacts far exceed just the parents not knowing where they're sending their child, what the school hours so they can make plans, transportation, not knowing what schools, what children are going to so they can do their routes, schools. I think that's why Ms. Moffett is here to talk to us about the health concerns around that. So I don't think unless there's other questions about pre-K. Ms. Martin?
So just so I'm understanding, because I think we drifted into kindergarten too. So the pre-K, the initial deadlines, end of April, first lottery happens the first week in May. Then we'd anticipate, when does and in that, let's say, we'll estimate 60% get placed. So is that 60% of the total, or is that 100% of the total getting 60% of their selected slots?
That's 100% of the early applicants
Okay.
getting their preferred slots.
Okay, perfect.
Well, not 100%. It was 90-something, and then we had the the one lottery.
Yeah, that's cool. So we'll do the first lottery happens week of May 1st. When does the second round happen?
We have that in the middle of June. So again, this is before the school year ends. Again, we anticipate with the strong push, everyone in a program right now should have the communication to do, to indicate what their choices are. By that point, I'm not quite sure who's still applying if we do that strong push, because we have found that most people are living in Lowell who applied prior to the start of school. It's after the start of school where a lot of newcomers started coming in. So we still may have an equity challenge of the most in-demand schools being completely full by the time newcomers arrive. But nonetheless, I think it's worthwhile to continue the 3 lotteries this year, because that third lottery really is a very small percentage of seats. At each point of the lottery, a very high percentage of families got their first choice, as evidenced by not needing a lottery. So we only had a lottery for one school last year, which was Pine Arts.
And the third one happens?
The third one would be the first week of August.
And by that point, you'd anticipate, like, the total percentage that are already in and through the first 2 lotteries would be upwards of how many
Like,
percent of the total?
Most of the class is already
Okay.
scheduled, and then after the first day of school is when we start to get an influx of
Yeah.
newcomer students.
I mean, I do think, and I think we've talked about this, I mean, the secret of it all is getting things done as early as we can, knowing that there will be things that happen at the 11th hour, but the more we can kind of get ahead of ourselves, the better it is for families and for the process. Thank you.
I guess at this point, we could go right to the kindergarten registration timeline, how you see that playing out. And I wanted to ask, you mentioned that most of the students are living in Lowell, so they're already here. They're just waiting to register because we've extended the registration period. I mean, the way we used to do it, you had a registration period, and it was much earlier, and that was it. But we always have newcomers coming in. So doesn't that overload the system in the summer when we don't really have the staffing, if we're still doing these lotteries for pre-K and kindergarten? Because we're always going to have K to 12 or pre-K to 12 people coming in at the last minute.
So the bulk of both pre-K and kindergarten would happen prior to the end of the school year. So again, our kindergarten class, right now, the majority of our kindergartners are already in a program somewhere, whether it's daycare, whether it's part-time pre-K, whether it's Head Start. The majority of our class is somewhere, and we just need to really work closely with all of our partners to encourage families to get the paperwork in early.
But if they know that there isn't really a deadline because of the lotteries, I mean, couldn't you save seats for newcomers or homeless children who, don't have an established residence when the application period happens? I mean, has that been explored? Holding seats for a certain small number, and then you can move forward with the whole immunization, verification, all those steps that are being pushed out into the summer because we're still doing registration.
Well, I think that's the third lottery, is the holding of 10% of seats, which are most of our schools are 4-strand schools, so at 22 students a strand, that's 88 students, so that means that 8 to 9 seats might be available in any given school past June. But we're finding that more seats are available because once everyone has come early and gotten their seat, at that point, whatever is left is where we fill. So we have technically reserved at least 10% of seats in every single school building. Some school buildings might have 25% of seats available. Some school buildings might have 15%. But by holding the third lottery, we at least have 10% of open seats available until the first week of August. And then in a 2-strand seat, that's 44 seats. So we're really talking like 4 seats open in a 2-strand school.
Ms. Martin?
Have we investigated, because I know we, in terms of the community partners, having our staff go to those sites to assist with registration?
Mm-hmm.
So they'd be able to go to the site, work with the parents
Right,
right
yeah.
there, do the online.
Well, we've been talking about off-site registration, so I think thinking about where can we have mobile registration sites. I don't know if it's every single building, but maybe we can get closer to different buildings, right, so that they don't have to come downtown.
Right.
But that is something that we're
I mean, I would think there'd be sites, certainly where the kids are is the easiest one to go, but I mean, at like the housing authority or, some other kind of places where we can get a good number of parents all at once.
And then in terms of the kindergarten registration timeline, is that different from what you just told us for pre-K? Okay.
So pre-K is just one lottery, and then first come, first served. So both the pre-K and K, we're proposing that the application process close on the 24th, and then they have the first lottery the first week of May, and then after the first week of May, pre-K is first come, first served. Kindergarten continues on the lottery process. So the second lottery just for kindergarten, we were anticipating the application closes June 7th, and then the lottery is June 14th prior to the close of the school year. And then at that point, the third K lottery, the application process would close July 26th, and then the K lottery, the final third lottery would be August 2nd, And then after that, it turns into first come, first served placement.
Any questions from my colleagues? Ms. Moffett, would you like to, I don't think there's a mic where you are, so come over here.
Can I just ask one more
ahead.
clarifying question? Just, is it made clear to all kindergarten parents, all preschool parents who currently have their students in pre-K at Lowell Public Schools, that they still have to go down to the Family Resource Center or go online and to register their student for kindergarten because it's not an automatic? Is that made?
Yeah, so they can go online to register. They don't have to come down to Family Resource Center. But we're hoping that with the communication, any challenges that they have, we'd be able to troubleshoot some of that with, their current teacher or, just strengthening the communication.
Okay, I just want to make sure that that's known for them. Thank you.
Thank you, Ms. Moffett.
Thank you. So, were you saying that kindergarten registration will close June 7th?
That would be for the second kindergarten lottery. So for the first round, it would be April 24th, and then the first lottery would be the first week of May.
Okay, so the reason I came today, too, is I just wanted to give some information about the impact that late registration has on the healthcare system, because it has a huge impact, and even more so the past couple of years with COVID due to staffing. So when we always held registration in the month of March, I have my office, there's 4 of us who would review all these records, and we could get notices out to parents. Parents want their children to start school on the first day of school. My nurses are done the last day of school. My office is closed. We're all done. I try to have one nurse come in once a week during the summer to review catch-up ones that have since registered. But if we have a huge bulk, it's an impossible task to accomplish. The other piece that comes into play is now we're sending in bulk these notices home to parents to get immunizations. I spoke with Lowell Community Health Center today. They have a wait list, and they said it is a few months to get into their office. So if we can send notices home in March and April, these families all have the opportunity to get appointments and still get their immunizations in a timely manner and start school. If we're sending notices home in July and August and a lot in September like we were, these parents don't have the opportunity to get immunized. Lowell General Immunization Clinic just closed in December. That's going to be a huge hardship for our families, like really huge. Pharmacies are very expensive, so we really, Lowell Community is our mainstay. And in order to get these students, because most of the students are here already, they're here, we need to get them set up and get their immunizations through mostly Lowell Community Health Center. And I feel like we're really doing them a disservice to extend it and not have them getting notices until July and August, and then frustrated and nervous and worried my child can't start school because I can't get my shots. So we really do overwhelm the healthcare system when we postpone that because of the notices and the staffing that we have. The pharmacies are very expensive for them to go to, so that's really not even an option. They don't do like, Lowell General would waive fees if a family couldn't pay. The pharmacies do not do that. So that's the bottom line with the healthcare system and the staffing, and both their staffing and the staffing at the health department. We need to get families registered. Like, there needs to be a cutoff so that they know they need to get these registrations in a timely manner, so we have time to review them. And there's, the other thing is, it is Massachusetts law. We have to follow the law that we're not supposed to give any child a seat without compliant immunizations. We have to think about the other students. We have children that have cancer in the schools. They have a short window of time during chemotherapy that they can come into class. we can't have them sitting with unimmunized children because it's putting them at risk. So we're thinking about the health of the entire community when we're talking about immunizations and getting them done in a timely manner. And none of us want to exclude children from school, but it is the law and we have to follow it, and it's for the safety of really everybody that's in school and sitting in that classroom. So that's my reasoning for keeping this registration early. And that's a big piece of it. Thank you.
Thank you. Mr. Lay?
Thank you, Madam Chair. I'm just surprised that, well, not surprised, but disappointed that just to get immunization for a kid, it takes about 3 months just to get in. Is it staffing issues or the supply? Yeah.
It is staffing, yes.
Yeah. Couldn't they make a priority for the kids? Because let them cut in line a little bit just because they need to go to school. I'm just saying.
Well, I did talk with the manager about that today, and she said in some cases we can try to get in touch with them because they don't want to hold these kids out of school. But if we're referring 300 children to them at the same time, they can't make priorities for 300 children. It's just not going to work. That's why it needs to be staggered over several months.
Thank you.
Ms. Martin?
So when we go through this first wave that we go through in April, parents are registering. When they're registering, are they considered registered if they don't have the immunization? Or do they have to, until they have the immunization, are they not yet considered registered?
I think that's a question for Latifa.
Yeah, so that's a good question for this year because during the COVID years, there were flexible, well, I know we're still in the pandemic, but in prior years, I do know, like with the pre-K, if the family applied and the only thing that they were waiting to finish was the immunization, we did not kick them out of the lottery because, as Ms. Moffitt shared, if they're waiting for an appointment, why should they be kicked out of the lottery if they can't get their appointment? So I think that's something that we need to consider is if the family, has attempted to get it and they haven't been able to, close, are we saying, sorry, you have to get out? Because a lot of times those who are impacted are those with the greatest need. So, as I shared earlier, we have set earlier deadlines to, for families to get their applications in. Everyone who's sitting in a pre-K seat right now, these are communications that we can give to families. I do have concerns around the, students' access to required immunizations because education is also a civil right for them. So we're in the midst of these two conversation of rights, right? Rights and requirements. So we did partner with the Lowell Community Health last year to have the immunization clinic. And so that's something that we can continue to discuss with them is, outside of their regular appointment system, they did identify times where families could come specifically to get their immunizations outside of the appointment system. One of the things I have not been able to successfully get to the bottom of, but I have been told that pharmacies offer immunizations, except that I think it's not covered by insurance. And so I'm wondering, how families maybe could access pharmacies who can't otherwise pay the cost. I can't recall, Ms. Moffitt, was it $20 for immunizations or some? I can't recall what the cost is, but again,
I actually got a listing today from one of the nurses sent it, and I forget which place it was that she sent me, but it was like $200 for a varicella, and it was, the cost was astronomical, and on top of whatever the immunization was, there was a $45 administrative fee, so it was astronomical.
right, so
Yeah, no.
I was probably thinking of a different immunization, but it speaks to, just the issue around the immunizations and how it may be available if you have the money to not wait in line to go to your practitioner. And how do we as a school system where education is required for kids, like what is, our responsibility to support them getting the immunizations quicker versus just saying, well, you just got to wait a month, sorry. Like, it's true, we have to ensure safe environments, and it's also true that they have a right to education. So then how do we do both of those without one taking a back seat to the other?
Well, I would think that as we kind of start this process, I think a partnership with Lowell Community Health Center should be the number one thing we do. I mean, that's the first conversation we should have. If we can get them to set up some specific clinics for our students, again, it'd be nice if they didn't do them, at the health center, if they could do them in various locations. Because I think we could pull together a critical mass of students in specific places for, I'm thinking the pre-K and kindergarten. But the other thing would be, I think that if you've got a family that's going through their registration and they have, they can't get an appointment for 2 months, but they have an appointment. So, I would consider that a complete application that can then get processed and then, so they can get placed, but they have the appointment so that they're coming back. It seems like there should be kind of a line in the sand that you can't get placed until you've at least you have a plan. So, I would think that would, I think these two competing, I can understand the concern around these two competing priorities. But I think the only approach we can take is to make it as good as we can. We won't be perfect, but we need to, put in place, make it as early as we can to accommodate, give as many options as we can to accommodate, and then just recognize that there will be, families who will be, struggling, and those are the ones that will get placed in August, but need to take will be in an emergency situation to get those vaccines. But the more we can do ahead, it's kind of, success by a million cuts. Every single one that we get through the process early is a victory. And just the more we can do that, the better off we'll be. Thank you.
Agree.
Mr. Lay?
Thank you. So I'm still get stuck with the 3 months, the loops of 3 months waiting. So when you go to a big event somewhere, it's always a member of a Lowell Community Health Center staff going there to administer COVID immunization, or Cataldo would do that for you. So why couldn't we do something similar to that around school opening days, just to speed up the process? I'm just wondering why would that be different?
So I'm not sure what Cataldo has for child immunizations. I'm sure that could be something that's looked into if they're willing to do that. I don't know how they partner that, but it's something to look into. But with Ms. Phillips saying, it's hard because you do have those two things, the right to education and immunizations. But to me, the simplest answer is we go back to what we always did. We did it. I've been in the city for almost 30 years. We've always did registration early. We never had this issue. We just never had it, where we had all these children that couldn't get into school because they didn't have their immunizations. And the bottom line is they're waiting because we're waiting. Like that, to me, that's what it is. We need to get them notified sooner.
My first year here was 2019, and we did have a long list. So but I think the point taken is that we can do more to get them in and ensure that, we get it taken care of as early as possible.
And I think it's not just the application. The nurses have to have the opportunity to verify the immunization so that you can go back to the families and say, you're missing this, you're missing that. So that piece has got to be built into the timeline, as well as then waiting 2 months or 3 months. So if you have applications that are coming in that are expected to be looked at in June, July, when we don't have the staffing, I think we've got a problem. I think that this idea of looking at the bulk of the families are already here. let's communicate earlier, more often, whatever, do a better job, and letting them know there is a deadline. It's not just a rolling, you can apply now, or you can wait, that there's an advantage to getting in by a deadline. And then have a backup that is seats available at each of those priority schools that are getting filled up, or something that doesn't put us in this situation where I think that, the health impacts, the health program impacts that you're speaking about, I get, but I've also heard it from the parents. I need to know what is the transportation, the babysitting I've got to work out. From transportation, they're also suffering from a staffing shortage. We don't have enough bus drivers for the routes we're currently running. They need to know where are we sending the kids, from what neighborhoods, going to what schools. And the school buildings, they also like to have a sense who's coming before they leave for summer vacation, because then everything is crunched at the end. I'm looking for a solution that's going to check those boxes in a way that seems to make sense for all the stakeholders.
So do you feel like the April 24th deadline isn't soon enough? Sorry. So do you feel the April 24th deadline isn't soon enough?
It's certainly better than what we've done in May, so it will be helpful. Prior to a few years ago, we did do it through the month of March, and then pre-K was after that, and pre-K wasn't as many students, so it wasn't as overwhelming. So we did kindergarten, I think it was for the month of March 1st through March 31st, and then pre-K was sometime after that. Yes, it certainly is more beneficial, I think, because of the trickle effect, to do it all in March.
Both going to be April, they're talking. Right, we're going to be doing pre-K and kindergarten for April 20, that's the plan, right, Ms. Phillips? So it would be both trying to all come in the month of April, and that's better than, but we still are going right till August. That's what,
But
anybody,
those are going to be the people who haven't applied yet. The ones who come in August are ones who aren't part of the system, who don't, new to the community. They're a different kind of subset, I think.
but if you look at the number that applied late, I think there were a significant amount who were in the city. They just waited. They did, because
Yeah,
there
I don't know
wasn't
that.
this sense of deadline. And I think, Ms. Phillips, maybe you can give us that breakdown of how many, because you did say the majority of the people are already in the city.
Right.
Right.
So if they're here, why are they waiting? We need to, have this communication, this urgency. But I do see that April is better than the summer, but it is still backing it up a bit. But I know you've also had changes at the Family Resource Center. So I want to be, cognizant of that, that it would be a lot for a new person coming in, although what is today, or tomorrow's February 1st. So-
January 31st,
Right.
Wednesday.
Oh, Wednesday's
And,
February.
and the goal isn't to wait until April to process the documents. It's an ongoing communication push for families to, the Family Resource Center has gotten busy since last week's showcase. So families already are coming and they're applying, and I think we'll be able to track their application patterns. Who knows what? Right now, we haven't done a huge communications push. One, because we haven't had this conversation, right? But the application is open for any family to apply right now. The question more so is that, they don't know when the application closes, but they do know that it is open. And so our communication push for next week is to be able to share them with them. This is when it closes. This is when the first lottery would happen. This is what the first lottery means, even though I do believe that many families know what the first lottery means. We're trying to reach the families that aren't looking to compete in a school, I guess, because there are families who think, well, when the first day of school comes, that's when I'll show up. But we're saying, no, if you're in any kind of program, if you're getting dropped off to any kind of program, we're hoping that our community programs will partner with us in that information for families.
Just in terms of messaging, I think what we say next week is the deadline to be included in the first lottery is April 24th. A completed application, hopefully, with the caveat of the vaccination information that you would need to have at least a verified appointment. And we should say 90% of our seats are filled by the end of this first lottery. I mean, I think that lays it down that, the reality is that if you don't get into this first lottery, your chances go down of getting what you want, because there's only 8 or 9 seats that are reserved, and, those are, that's a last-ditch effort. So, I think we need to put some urgency in the messaging that shows families that there's a real benefit to getting in early and getting all your stuff in early, because then you get first pick. And I think, that's compelling.
And if it takes months to get the appointment, or if we have Lowell Community Health Center who's willing to hold one for us, although I think the mobile piece with staffing issues might be challenging, but if they give us, this is gonna be the Lowell Public School Day, we're gonna do immunizations here and here, whatever, you've got some time to roll that out. But right now, we're not making a decision because we're meeting before the full committee in 2 days. And I do want to be cognizant of the time, so unless there's some of the last issue on this.
I'll just say one more thing. So it's like a rolling registration right now. So as they come in, my clinical managers are reviewing these. So there were 12 on the list so far. And of those 12, 9 were already cleared and 3 of them got their notices. So they do it on a daily basis and they're going through it. It's just that when we get that big rush at the end, like last May, that people weren't, I think, and that's what it was. They didn't have the urgency that they had to register. So they were all doing it at once, and that just didn't work with the healthcare system.
And last May was delayed because of the FRC audit. So that's what makes last year an anomaly. So yes, the goal is to get them through, start communicating right now, the application's available, get them placed.
Well, I think this has been good to share concerns and come up with solutions, and we will be talking about this on Wednesday. So thank you again for coming. Thank you.
Thanks for coming.
So the next item on the agenda is, we need a vote. Do we need a vote on the changes to the preschool policy? We should probably, we had some language changes, just to, if you want to read that for the record, that we are going to be recommending to the full committee that we make those adjustments that we're now offering parents' choices to community partners for pre-K. Ms. Phillips?
So the recommended new language is that that we will include Lowell Public Schools part-time and full-time programs, as well as options within approved community partner programs within the application process.
A motion by Mr. Rossi to change that language.
I'm just going to put reviews the revised pre-K policy.
Okay, perfect.
That's enough, Latifah?
Seconded by me. All those in favor? Aye. So, I don't know, can we go to the next item under communication? I don't want to.
budgeted your time.
Oh, so you're giving me a little extra? Thank you so much. Okay, so under policy, the procedure for placing communications on the school committee agenda. I don't know if Ms. Phillips had anything I know you had sent us some policy information. Is there anything you wanted to say, or should we just go launch right into it?
No, so you have the current policies, and as you could see, there are different processes, right, for communication, whether it's giving, public testimony and how that gets put on the agenda, right? So there's the rules for public. Here's an extra copy for you. Couple extra steps.
Anything else about it, or just, okay?
No, just that I think, as you all discuss and just share the crafting of a new policy. We would just want to be mindful of what's in the other policies and how it aligns or how it conflicts, just to have an aligned
Right.
policy.
Thank you so much, and thank you for this information regarding what we already have in place that has to do with communication. And I guess really the whole purpose of discussing this and my motion was to have clarity around the agenda piece and communication that should be put on the agenda. I think that it's, as we were told by Glenn Kuchar at the Mass Association for School Committees presentation to us, the agenda really belongs to the school committee. It's our, tool. Right, and responsibility for doing our work. And I just wanted to start by making sure, and I think we can't do this with just the few of us here, but we want to make sure that all school committee members are getting their emails from the website, first of all, and if not, what needs to happen to make sure that we all have a LPS address that we can have access to communication to us. So some communities, this is again from MASC, I did a little more research with our field director, Dorothy Presser. I don't know if you guys are familiar with her. So some communities have an executive secretary to the school committee who manages the agenda. This is a role our recording secretary could take on. Other current policies our current policy is to have the superintendent manage our agenda, and I'm not making a motion here today to change that, but I just want, for purposes of the committee and the community, to know that it is our responsibility, the agenda. In terms of communication, I think that if we break it down into some of the different types of communication, like if we get communication that, first of all, if there's communication that is addressed or copied to the school committee, it should be included on the agenda, especially if it has to do with an area that's under our purview. And I give you the example of the Board of Health letter, and the letter we got from the former solicitor, or other organizations that would be writing to us about matters that pertain to our role as the governing board. And I think, so that would be the first tier, any communication from any organization. If we get communication from a parent, for example, that is not something that's generally under our purview. If a parent is complaining about a staff person, that's not in our area of purview, and that would be best referred to the superintendent. So you might get an email from a parent complaining about something, that could be forwarded to the superintendent for him to designate somebody from, the building or whoever would be appropriate. That's a different kind of communication and would not really generally go on the agenda. If we get an employee complaint, that is also typically not our purview to address and would be best forwarded to the appropriate administrator. Again, I always kind of default to the superintendent. So I guess if an employee writes a letter, so we have gotten communications in the past thanking us for a memorial, right? Or we had a communication from Dr. Palaccia recently, just informing us that she was resigning and thanking, us about her service in the school district. Those would be acceptable forms of communication. And I'm looking to try to codify this, have it in writing so that it is clear where the boundaries are in terms of communication. So it's not me looking for where's this letter from Desi that was supposed to be copied to us, which happened in the past, not under this administration, or where's this letter from the Board of Health, things like that. I don't know if there were any other thoughts about communication. Ms. Phillips.
Thank you for sharing that. And I'm sure I'll follow up following this meeting. But some of the things you immediately shared around the written communication. So when I'm looking at the rules for public comment, right, which is someone speaking their matter, right, versus writing their matter, I think this is an area around alignment, right? Because in looking at like the rules for public comment, it directs that the request should be in writing to the superintendent at least 1 week prior to the date of the meeting. You know, the chair of the committee works with the superintendent to formulate the meeting agendas, and together they'll determine whether or not to place an item on the agenda. I just share that around the verbal, like, public comment, and just the importance of distinguishing, like, the written comment, right, versus the public comment, and then how do you determine, just so that it's in alignment, right?
Right, that's a very important
Yes.
distinction. Thank you for that.
And the complaint process as well, right? Like, if it's a public communication around a complaint, you know, if it's an individual, the complaint process, the public complaints follows a channel, right? So again, we just have to have clarity around which communication is like a, I guess, good news communication, because even that could get really long, right? So do you want, you know, I could see lots of organizations saying, oh, I'd like, you know, everyone and the school committee to know this, and I'd like everyone in the school committee to know that. And your agenda could get populated with lots of items that become like a billboard of sorts. So, again, this isn't going to get resolved here. I just wanted to share some initial thoughts as I was listening around, like, if you get a letter that's a complaint, how does that align with public complaints? If you get a letter that sounds like a public comment, you know, how is the public comment different from the written public comment, right? So just some thoughts for moving forward.
Thank you. Ms. Martin?
And I think we can kind of go through, we'll need to parse this out. I mean, I think that first tier, as you kind of describe it, I think that is official communications to the school committee from other government bodies, from, you know, from entities that are officially communicating to the school committee specific information. You know, not, we're having an event, please come, you know what I mean? So I understand what you're trying to build in as a distinction. So, I mean, I think that's the top level. I think, to Ms. Doherty's point, it does make sense that complaints, you know, those should go to the superintendent. I mean, again, they should be shared with us, but they should be going to the superintendent to be resolved. And then, you know, when there are those circumstances where the committee wants to follow up, we have the opportunity to make a motion and bring them on, you know, bring them on that way. But I do think that the other point about the emails too, I have tried for 10 years to have my emails go to my school committee address, not my personal school committee address, not the one that the district has given me. I can't even tell you how many times I've asked for this to happen, for things just to forward. It's not a difficult thing, and it never happens. So sometimes I get them, sometimes I don't. They never go to my personal school committee address. They'll go to my professional address, which, I mean, at least I get the information, but that's really not where they should go. But it has led to, you know, there's a lot of things that I don't get because it just doesn't forward appropriately. I mean, I'm looking at you, but I know that's not you. Yeah, go fix my email. Yeah, I would think they'd have to. I mean, but again, I've asked multiple times, and it's never kind of been able to be resolved. But that's just part of kind of improving the overall communication structure. Would our next step be that then we get a proposed policy that will mark out these different tiers of communication? Because I think that would be helpful.
I think it would be, if we could, just for purposes of clarifying. And I wanted to, so when we talk about the public comment piece, I think, and I'm just going to speak for myself, I very much want the community to feel that we're open to hearing concerns, whether it's our staffing community or our parents. I thought with public comment, you had to call the day of the meeting, and it had to be on something that was on the agenda, or is that a separate kind of public comment?
That's how the,
2 o'clock on the day of the meeting.
that's
But
how
if
the
these-
process have been, yes.
If these letters or whatever were put on the agenda, then you could comment on everything.
I see.
So like if there was, again, like a community event which we all want to hear about, but
Right.
then some, you could get into 20, 30 minutes of people
Well,
talking about
just because it's on the agenda doesn't mean you're gonna have to talk about it. You can, I mean, we got communications, thank you for the memorial from my father. We don't discuss it, it's on the website, we know it's there, we all get to read it when we read our packet. But I do wanna, there is this public comment piece that anything on the agenda, the community is able to speak on, you get 5 minutes, you call or email the superintendent secretary by 2 o'clock of the day. I mean, that's a separate thing from some of this other public comment, where there might not be something on the agenda, right?
And that has been the practice.
Yes.
I think in looking at this policy, I don't know how outdated it might be.
Right.
But,
Are you aware?
but,
this one.
again, just wanting the practice to align with the policy.
Right.
To align with any new policies.
So I think we need to update that policy to include this part. If you want to speak to something on the agenda, you need to, do those steps that we already talked. Call the superintendent secretary by 2 o'clock or email. And it has to be on the agenda and you're allowed 5 minutes. If that's not anywhere in here, we need to add that.
And it's in here.
It is
It's
in-
in here on the rules for public comment. Yes.
But the part that was separate was writing something to the committee.
Yeah, such a request should be in writing, received at least 1 week prior to the date of the meeting. But in practice, we have allowed anyone up until 3 PM, 2 PM?
Well, it's the school committee rules say that they're allowed to register up till 2 o'clock the day of the meeting. And the school committee votes on that the day of their inauguration.
Oh, a
So
different- a
just to
different
align
policy.
that with, with our rules. Okay, so I think we've got some progress here in terms of the communication piece of the agenda. There is one more item, but Dr. Hall has given us the paperwork on that tonight, and I want to be cognizant, we are 8 minutes over the next subcommittee meeting, so we are going to hold that for our next meeting. Unless there's any other objections, I would entertain a motion to take this as a report of progress. We will discuss it at the full meeting on Wednesday by Ms. Del Rossi. And to adjourn. Can we do all that at once? Sure. Seconded by myself. All those in favor? Aye. Thank you very much.